What is hepatitis C? Hepatitis C is an infectious disease caused by the hepatitis C virus. Hep C is spread through blood-to-blood contact, which means that you could get Hep C if blood infected with Hep C gets into your bloodstream. Many people living with Hep C will have no symptoms for decades. If left untreated, Hep C can cause serious liver damage and liver cancer. In British Columbia, 60,000 to 80,000 individuals are infected with Hep C, of which 75% are among those born between 1945 and 1975. This is because many of these individuals received blood or organ transplants or were in contact with medical equipment that was not properly cleaned before Hep C screening was introduced in 1992. Who else is at high risk? The remaining 25% of the population at high risk of infection include people who inject drugs, men who have sex with men, and people living with HIV and/or Hep B. Is there a cure? There is a new cure for Hep C called direct-acting antiviral therapies. These drugs are effective 95% of the time in as little as 8 to 12 weeks. Despite remarkable improvements in Hep C cure rates in recent years, access to these drugs remains low among many populations at high risk of infection. Can I get Hep C again? Yes, even if you are cured, it is possible to get reinfected with Hep C. What is the Per-SVR study? The Per-SVR study is a study of people who have been cured of Hep C infection with direct-acting antiviral therapies. Conducted by the BC Centre for Excellence in HIV and AIDS, this study is important because a greater understanding of Hep C reinfection will help us make the case for treatment as a way to prevent future Hep C infections and reinfections in our community. This research could provide evidence for increasing access to these life-saving drugs. This study will look at things like contact with harm reduction services, such as needle exchange programs, substitution therapies, and supervised injection sites, as well as other health services, and their impact on Hep C reinfection. You may be eligible to participate in this study if you are 19 years or older, if you have finished Hep C treatment in the last 3 months, if you are completely cured of Hep C with DAAs. Unfortunately, those who were able to get rid of the infection without the help of DAAs would not be eligible, and if you live in Greater Vancouver. What's involved? Participants will be asked to attend around 10 visits at one of our study sites in Vancouver. At each visit, there will be an interview and blood and urine tests. Following each visit, an honorarium will be offered. If you are interested in participating, we would love to hear from you. Please feel free to call or email, or drop by our 625 Powell Street location. With the help of those participating, the Per-SVR study can provide evidence to help improve access to treatment and improve the lives of people living with Hep C.